everybody. Welcome to webinar number 27 in the Independent Gym series. Thank you for joining us. If you're with us, thank you for re-watching if you're catching up with this later in the week. It's a busy day today for some of you up in Scotland. I think you're obviously reopening today, so you're probably not watching us if you're from there. Northern Ireland and Wales, not too long to go. Within a week we'll all be open, which is fantastic. Today's webinar is hosted by Partners And. We've got Neil Adeboale from Partners And Chris from a company called Stallard Kane, who are health and safety consultants working closely with Partners And. Today we're talking about health and safety, so we're talking about how to navigate the threat landscape for independent gyms. Health and safety is one of those subjects I think can be glossed over quite easily, but it's obviously really important. So we wanted to host this webinar to try and help you with reopening essentially. So as usual, we're going to be doing a Q&A through the chat feature. So if you've got any questions as we go, drop them in there, and we'll obviously record this and it'll be posted in the group for everybody to catch up on later. So on that note, I'm going to hand over to Neil and away we go.
Great stuff, Robert. Thank you. Yeah, firstly, just really excited to be here. Personally, I've been involved in working with independent gyms for a long time, probably about 13 years, arranging their insurances. So for me, when Rob sort of approached us with a proposition of working with the independent gym group, we jumped at the chance really, because this is our background and our bread and butter, and really what a lot of our business was built off the back of working closely with independent gyms. So something I'm very passionate about. What we are looking to cover off, hold on. There we go. Couldn't change to the next slide. It is to give you a high-level overview of health and safety. We're not going to go into a real deep dive today in the short time that we have, but we want to give you enough of an idea to give you some thinking points, what you need to take away, where you've got some great resources to go and access some further assistance, and really make sure that you can cover off this key area. So as Rob's introduced, I'm Neil Adeboale from Partners And. Partners And are the lead partner for insurance for the independent gyms group, and we have a specialist area which deals with gyms and health clubs. So it's very much, and that's the area that I look after personally. Part of that is our knowledge and expertise of the market, but a major part of that is the support we give around risk management advice as well. So hopefully that will come out during today's presentation. But in order to have the necessary expertise, we're working with our specialist partner for health and safety, Stallard Kane, who have been a leading consultant in that area for 21 years. They are specialists not just in health and safety, but also in compliance, HR, and employment law. And we have a very close partnership between Partners And Stallard Kane. I'm going to give a bit of detail at the end of this presentation about how that works and how you can access that as well. So why is this a hot topic now more than ever? Some of you may have heard the term bandied around, the hard market in insurance. So this is effectively where capacity is reduced within insurance and it becomes difficult to, or more difficult to purchase. There's a number of reasons behind that, which we don't need to go into now, but essentially there are fewer insurers underwriting business. That can affect some areas, and leisure is one of those areas that has been impacted by that. And that therefore means that insurance can be more expensive, but it can also be more difficult to get, so availability becomes a problem. And one of the effective ways to make sure that you can purchase insurance and that you can control your costs, probably the most effective way to do that is to look at how you manage your risk. And a key part of that for the gyms and health clubs essentially is getting the health and safety element right. And that's what Chris is here to talk about for us today. I have thrown in another area there why it's really important, and that is in terms of the retention and the service you give to your customers as well. At a time of, I guess, heightened awareness of this, that COVID has brought, that really is a key element. People are looking at cleanliness, people are looking at safety, and the risks involved in going to the gyms. And we just think that's a real positive reason to get behind this right now as well, rather than just the potential negative pitfalls of getting it wrong. If you like, there is a real positive benefit to be gained from getting this side right as well. Now, over the last year, and as I say, I've worked with gyms and health clubs over the last 13 years. There's never really been a year like the last one, of course, but lots of new risks and trends have emerged, and we can talk about digital fitness and the impact that's had on the risk environment, the importance of people and the well-being of those. We already did a presentation on people and well-being and why that's obviously a key area now, but the people risk has changed within the business over the last year significantly as well, or the events of the last year have highlighted the importance of that, and of course COVID itself and the awareness of other contagious diseases as well, so the impact that has on how you deal with that. But I think the key point I want to get across today is there are lots of new trends. We've done some work and some blogs around this area of these emerging trends, but what we're seeing is that the same risks are still just as prevalent as they ever were. And you think about the risks in the gym environment of slips, trips and falls and equipment failure. The changes in the last year haven't reduced those or taken those away at all. And the same approach is needed. And I think there's been potentially an element that there's been so much focus on COVID that some of these risks have perhaps been sidelined or forgotten. And we just want to make sure that those are still highlighted as a key part of looking at what you need to address. So on that note, I'm going to pass over to Chris, who's the expert in this area. No pressure, Chris, but I will come back at the end, as I say, just to outline how you can access the support for this area as well.
Okay, thanks, Neil. Hello, everybody. My name's Chris Bartley, and as Neil said, I'm a health and safety consultant for a company called Stallard Kane. We work very closely with partners, and what we wanted to do today is give you a brief overview of health and safety management, because over the past 12 months, we've all had to become experts in COVID-19 measures and bring ourselves up to speed with COVID-19 guidance so we can ensure that we reopen and that our gyms are COVID secure. But this presentation, we wanted to concentrate on general health and safety management. Just like Neil said, we just want to make sure that general health and safety doesn't get sidelined because we've been concentrating so much on the COVID-19 measures. What you might find is that in the process of carrying out your COVID-19 risk assessments and implementing your COVID-19 procedures and measures such as enhanced cleaning, extra space for social distancing, that this has actually improved your general health and safety measures as well. From personal experience as a gym member, I have noticed that hygiene measures and standards have improved within my gym. Even gym etiquette, which is a big one, has improved, with people putting their weights back and their equipment back and not leaving it out, which means better floor space, cleaner workstations and better access and egress. So what I wanted you to do really is take you through the ways and means of managing health and safety within your gyms and your organizations. And firstly, what we need to do is look at the three main reasons for managing health and safety. And those are moral, legal, and financial. Now, if we look at moral reasons for managing health and safety in a little bit more detail, it's society that places moral obligations on people to behave in a reasonable manner and ensure that we look after each other. In regards to your organization, society expects that employers take reasonable care of their employees, and in gym users and general public. And it shouldn't be a condition of your employees that when they go to work, they're putting themselves at risk of health and safety injuries or health effects. Society also expects that the public are protected from harm as well. So that's our moral reason for managing health and safety. Now, we also have a legal reason for managing health and safety. We're going to cover this in a little bit more detail later on in the presentation. However, you have a strict legal obligation to ensure the health, safety and welfare of your employees and also anybody else who may be affected by your undertakings, such as gym users or anybody coming to carry out any maintenance on your facilities. We also have a financial reason for managing health and safety. Now, organisations require money to maintain their aims and objectives and to run. And the costs of not controlling health and safety can be detrimental to a business or an organisation. Managing health and safety is a ready measurable cost. But less ready available is the cost of not managing health and safety. And if we move on to the next slide, we can look at the costs of poor health and safety standards or poor health and safety management, if you like. And some of the costs of poor health and safety standards is that you might see an increased number of accidents, injuries, and incidents. Okay, poor standards means increased risk. So that can result in increased accidents and incidents. You also might find that poor standards and poor health and safety management will affect staff morale and staff turnover. Okay, this can be affected because if your staff do not feel like their health and safety is being considered, they may want to leave the business or they may just have low morale. Now, if you have a high staff turnover, this is going to cost your business in regards to having to advertise for new staff, which costs money. Taking the time to hire staff and then to interview them and put them through the induction process, all costs time and resources to the business. You might find that one of the costs to your organisation through poor health and safety standards is prosecution, okay? Criminal prosecution. Any breach of health and safety law is a breach of criminal law, and you may find that you are prosecuted by the health and safety executive or the local authorities, and this can result in fines or in the real serious circumstances. If we've had a fatality or a real serious accident and it's been a breach of health and safety law, the result could be imprisonment. You might find that you might lose members down to poor health and safety standards. Speaking from personal experience, again, as a gym user, 10 years ago now, I started using a gym that was a fantastic gym. It had great facilities. All the equipment was well maintained. Housekeeping and floor space was great. But over the years, those standards started to slip. There's more and more equipment being left unmaintained and out of service. The gym etiquette and housekeeping got worse over the years. And that resulted in me leaving and going to a gym that had better facilities and better standards. Another cost could be employee and public insurance claims, okay? That might result in increased insurance premiums, or in certain circumstances when you don't meet the requirements of your insurance policies, that your insurance gets revoked. Poor health and safety standards could result in bad or affect public reputation and corporate reputation. For instance, word of mouth is a great marketing tool, but if you have poor standards within your gyms, word of mouth will soon get round and people will want to join other gyms or leave your gym. If you get prosecuted by the HSE or the local authority under a criminal prosecution, it tends to become public knowledge. It's either printed in local newspapers, and again, in more serious instances, it could be on more, it could be in the local TV news, basically. You might find that because of low staff morale and high staff turnover, this can affect the efficiency of the way your gym works, okay? Even having, poorly maintained equipment and having to get that replaced, etc., or having it out of service can affect the efficiency of your gym. Now, we have something within health and safety called uninsured costs. Now, out of the list of costs that you can see on the screen there is only employee and public insurance claims that you can insure against. You have to, it's a legal requirement to take out employee and public liability insurance. But what you can't insure against is the increased number of accidents, injuries and incidents, the fact that your staff have low morale or decide that they want to leave and you have to spend the time and resources to hire new staff and train them up. You certainly can't insure against criminal prosecution. If you're fined by the HSE or the local authority in a criminal court, then that has to come out of the bank balance of the business. Okay, so if we move on to the next slide, what I wanted to cover is the legal requirement for managing health and safety in a little bit more detail. Now, under the Health and Safety at Work Act 1974, which is the primary piece of legislation in the UK, organisations like yourselves have a primary duty under Section 2 and Section 3 of the Health and Safety at Work Act, and Section 2 being that employers should ensure the health, safety and welfare of their employees. Under Section 3, employers should ensure the health, safety and welfare of anybody else who may not be in their employment but are affected by their undertaking, such as gym users or anybody coming out to carry out any work on your facilities or your premises. You also have a duty, if you're in control of a commercial premises, to make sure that that premises is fit for purpose and it's safe for the users as well. Now, under the Health and Safety at Work Act, we tend to find that a lot of organisations get prosecuted under either Section 2 or Section 3. To just give you an example of a company prosecuted in the leisure industry, in December 2018, a district council pleaded guilty to Section 3 of the Health and Safety at Work Act and was fined £27,000 plus £7,500 in costs. Now, remember, that's an uninsured cost. You can't insure against that, so that would have to come out of the company's bank balance. Now, this was after a member of the public contracted Legionnaire's disease from the leisure centre's hot and cold water system. What they didn't do was carry out a Legionnaire's risk assessment and implement suitable control measures such as temperature checks and cleaning of shower heads on a regular basis. That resulted in the Legionnaire's disease, the user contracting the Legionnaire's disease, and then the HSE prosecuting that organisation. Now, under the Health and Safety at Work Act, we have specific pieces of legislation specific to certain areas of health and safety, such as the Control of Asbestos Regulations 2012, the Provision Use of Work Equipment Regulations, and we could go on and on and on. But what I wanted to do is really concentrate on the main set of regulations, which is the Management of Health and Safety at Work Regulations, which sort of supplements the Health and Safety at Work Act, okay? The reason I wanted to concentrate on that is because the Management of Health and Safety at Work Regulations places an absolute duty on employers and organisations like yourselves to carry out risk assessments. And a lot of you will have carried out risk assessments because the government guidance on COVID-19 have said the first thing that you need to do is carry out a COVID-19 risk assessment. Well, just like that, we need to carry out risk assessments for our general activities, okay? As an employer, you are legally required to risk assess your gym and to find out what within your gym could cause harm and how we can control those risks to reduce the risk of injury to our staff and the users as low as reasonably practicable. The best way to do this is keeping it simple. Walk around the gym and follow what we call the 5 steps of risk assessment. What you need to do is firstly look at what in the gym could cause you harm or cause the users harm or the staff harm. Identify the hazards. So a hazard is anything that has the potential to cause harm. Is it work equipment? Is it housekeeping? Is it slips, trips and falls? And then what you need to do is decide who might be harmed and how. Is it the gym users? Is it contractors? Is it staff? Or is it all of them? And you need to look at each individual hazard and evaluate the risks and decide on the precautions. Have a look at what you've got in place already. Decide on whether you're doing enough or whether you need to do further or implement further control measures. And finally, what you need to, then what you need to do is record the findings and make sure you implement those control measures. There's no point in writing a risk assessment out, identifying the hazards and the control measures to be in place, and then not following up on those control measures, because it just becomes a box ticking exercise and a piece of paper left in a cupboard. You need to review those assessments and update as necessary. As a rule of thumb, I always advise reviewing your assessments annually. But if you introduce new activities like gym classes or new equipment, you need to make sure that you update those risk assessments as and when necessary. Okay, so what I wanted to look at next is some general hazards and controls that might be applicable to your organization. This list is not exhaustive, but it might, all the hazards might not be applicable to each individual gym. Each gym's different, but these are the general ones that I've come across over the years, and what I advise on with the control measures that need to be in place. Now, certainly gym equipment can be a hazard, and the best way to control gym equipment, the risk of gym equipment, is to make sure that the equipment is fit for purpose and maintained. A good way of doing this is checking it on a regular basis, and if gym equipment becomes damaged, getting somebody in to fix it. If it is damaged and it's going to be a number of days or weeks before it can be fixed, it is important that that gym equipment is taken out of service and signage displayed to inform users that they shouldn't use that equipment. Also important, and which could be a risk, is lack of staff training or no member inductions. So it's important that your staff are competent to carry out the work that they do. So have they got the right fitness training? Have they had the right health and safety training, such as manual handling training, fire safety training? Have they had first aid training? Also, member inductions are important. So taking new members around the gym, showing them the facilities, showing them how, or talking to them about how the equipment works. Even though they may well have been a member of another gym, each gym has different equipment, which is made by different manufacturers and would be slightly different. So it's important to give an overview of the gym equipment and how it works. And also give them other safety information, such as fire procedures, where the welfare facilities are. And in this current climate, you know, what the COVID-19 measures are and what we expect of our gym members. Okay, Neil mentioned earlier as well that housekeeping, slips, trips and falls are also a major hazard within gyms. Okay, the way I think, the way I sort of advise of controlling this risk is signs regarding users putting equipment back after use, especially in free weights areas, doing regular inspections and walk rounds of the workplace. And don't be afraid of challenging members who aren't actually following the gym rules of putting equipment back. And then also internal regularly cleaning and maintaining space and access within the gyms. It's also important to make sure that medical questionnaires are issued to members. By asking every member to complete a questionnaire, it gives you general health and safety advice on that member. And that will allow you to establish whether that member is ready to exercise or would need to speak to a GP before first exercising. It allows you to give them a little bit more information and make reasonable adjustments for them. Electrical equipment and installation can become a hazard if it's poorly maintained. The best way to maintain the electrical installation within the premises would be to have a fixed mains inspection carried out, generally every 5 years, by a competent electrician who's a member of the relevant association for carrying out fixed mains inspections like the NIC, EIC. Also, having pat testing undertaken on portable electrical equipment will help maintain the safety of portable electrical equipment. So you might have facilities for your staff, such as kettles and cooking equipment in the canteen, but also there might be portable electrical equipment used in the office spaces as well. So having pat testing carried out on these items is a good way of maintaining electrical safety. Also, some of you may have gas coming into the premises in the form of a boiler. To make sure that your gas boilers are safe, you must have a gas safe inspection that's carried out annually. by a gas safe registered engineer, and also have the boilers serviced on a regular basis as well. I mentioned earlier about a council that had been prosecuted for breaches in the Health and Safety at Work Act because a gym user or a leisure centre user had contracted Legionnaire's disease. Well, the Legionella assessment is important and generally would need to be done by a third party. Most of your gyms will have hot and cold water systems, and that risk is increased if you have spas or if you have showers, okay? And control measures that might need to be implemented are temperature checks of hot and cold water taps to make sure that they stay within certain temperatures, and regular cleaning of shower heads generally every 3 months, and regular running of the water systems that might not be used on a regular basis. You also need to look at gym layout, space and access. There should be adequate space between machines so that people can carry out their exercises, but they can get on and off the equipment safely. There also needs to be safe access around the gym for fire exits so people can exit in the event of an emergency. And again, going back to encouraging gym users to return free weights back to racks to keep floor space clear, and checking this on a regular basis will all improve gym layout, space and access. Supervision is also a lack of supervision, should I say, could be another hazard. Provide supervision when practical in manned hours, but I know that a lot of gyms in this day and age provide 24-hour access where the gyms may not always be manned and supervised. So maybe you need to look at assessing what other measures we need to put in place for those unmanned hours, such as security cameras or panic alarms. Fire safety is also another hazard, okay? It's an absolute duty under the fire safety order that commercial properties have fire risk assessments carried out, okay? Generally, this would need to be done by a third party unless it was a real basic set out and layout, but definitely needs to be done by somebody competent. And that fire risk assessment, dependent on the type of premises, the layout and the risk, would then recommend what fire precautions you might need to have in place. And that could be an alarm system that incorporates automatic detection, fire extinguishers of the right type and location, emergency lighting and the right amount of fire exits, and fire safety training for staff. Another hazard is poor hygiene and cleanliness. Now, I would hope in the last 12 months, everybody's enhanced their cleaning procedures. You'd have already need to have a cleaning rota on the likes of the welfare facilities and the changing facilities. But in my gym, what's happened over the last 12 months is they've implemented enhanced cleaning. They've put the onus on gym users to clean their workstations down before and after use, but then they've got their own staff going around regularly cleaning equipment, regularly touched points, and then obviously, again, as I mentioned, the rota for the toilets and the welfare facilities. And finally, another hazard that may be applicable to anybody whose gym's located in a premises that was built before 2000, the year 2000, it could potentially contain asbestos. So under the control of asbestos regulations, you would need to identify where the asbestos is, what type it is and what condition it's in, so you can manage it effectively, either have it removed if it needs removing, or if it's safe where it is and kept in a safe condition, it's checked on a regular basis so it doesn't become a risk to workers and to gym users. The best way to do this is to have a third party come in and carry out an asbestos management survey. Of course, they're not all the hazards that you might find within your gyms and your organisation. The key to it is to walk around and do that risk assessment. Now, I'm obviously open to any questions, so I'm going to pass back to Neil while he finishes off the presentation, and then I'll wait around for any questions that might be asked.
Brilliant. Thank you, Chris. Yeah, it's just there's really informative and obviously quite a bit to think about there for gym operators. As I say, I'm going to look at some of the practical measures we've got in place to support you anyway. Just before I do that, I just want to touch quickly on this issue. Chris has focused very much around the health and safety aspect of it. Just one idea I want to bring in is that from an insurance perspective, we're often focused on the defensibility of claims, i.e. if a claim does come in, if someone tries to sue you for an injury that they have, can we defend that claim? Obviously, prevention is the best way of not having any claim successfully against you. So I think the first point is absolutely focus on safety, as Chris has outlined with those parts there. And if you do all the right measures, defensibility will follow. But you may also need to think just a bit wider than that about some of the things you need to have in place to show that you've done all the right things effectively. So one of them is the effectiveness of CCTV, which clearly doesn't prevent injuries from occurring, but can be a really effective tool in demonstrating what actually happened. And particularly in a claim culture that we tend to have in the UK, that's really effective to deal with any spurious claims that might come in, or where someone alleges a different version of events to what actually happened in practice, where you had all the right procedures in place. Chris mentioned also about the importance of giving member inductions, but from a practical point of view, I realise that there are sometimes members that refuse those. We have put together what we call an induction training waiver. It just makes abundantly clear the member's been offered an induction, but they've chosen not to have that because they feel they're an experienced gym member. So that's just documenting that effectively, that they don't have that. Health commitment statements and PARQs, obviously in terms of the medical side, really important to have those documented and keep those records of them. And just generally in terms of record keeping, all those elements that Chris has mentioned in terms of staff training, in terms of cleaning and everything else, equipment inspection, essential that you do all those, but just as important that you keep records of them, because in the event of a claim, those are going to be your defence effectively, your effective defence to combat someone that's trying to bring a claim against your gym. So one final point just to remind you is that you can't contract out of legal liability. So if you have a disclaimer on your website or on your terms and conditions, you can't get out of the liability for injury to third parties. So in terms of accessing Stallard Kane, two main ways really, but both through Partners and the partnership we have with them. All of our customers, every Partners and client has access to Business Shield, which is a great facility that Stallard Kane have put together with loads of guidance that you can access. There's step-by-step guides, there's policies, there's sample forms and letters. That's actually far wider than just the health and safety side. So that will also include the HR support that you might need as well. So that's a great resource. So any of our clients will have access to that. But then Stallard Kane also offers some bespoke services. Rather than it just being purely advice, you can also book through Stallard Kane a lot of the additional elements you might need. We've talked about fire risk assessments, Legionella assessments, site visits and audits if you're looking for something like that, but also the kind of things like fixed wire testing and PAT testing. So there's a whole host of services that they offer, which help you to address some of these obligations and these requirements that you have effectively, where you don't have the tools to do them in-house. And at Partners and we've also just relaunched our risk management guide. So this is based around practical advice for gyms and health clubs. It's a 52-page guide with advice on loads of different areas, so unsupervised gyms, children's activities, outdoor classes. That was completed at the end of March, so it's now available to all of our clients, but we're also making it available to all independent gym members. I've given an address there to email for a copy of that, but I'm sure also if you get in touch with Rob and the team at Independent Gyms, they can pass that on to us as well, and we can make sure that you've got a copy of that risk management guide there. And just a final note really about Partners and the way we operate. Hopefully we've demonstrated that today, but it is largely about moving away from just a transaction where we arrange your insurances and you get a quote and a policy, and then we speak to you again at the renewal the following year. We're trying to bring out our sector specialist knowledge, the risk management support and expertise we have, but also the wider risks that you may face. We haven't covered these in the presentation, obviously, today, but things like the cyber risk, the risk around your people, which we covered in the previous presentation, and the claims support that we give, which is the acid test of any insurance policy. So that's really the way we want to work with our clients and want to support gyms and health clubs going forward. We'd love to help you, so I've put my contact details on there, but love to welcome any questions that you may have as well. And back over to you, Rob.
Thank you very much, guys. It's a strangely interesting subject, isn't it, health and safety?
Yeah.
And I think from my background, I've worked in gyms up until probably 5-6 years ago, and it's all the things that you don't think about that you should be thinking, that it just pops in your head. It's like, yeah, should be doing that, should be doing that. So it's really it's a good one. So anybody got any questions, fire them through the chat feature. I've made a list of a few, I think, questions, observations. I don't know what I'd call them really, but I think the first thing for me, and it summed it up with your last slide about partners and insurance is the sort of thing, and I do it with my car insurance. You go out for the cheapest policy you can get, tick the box, and you try not to think about it for another year. But I think in this instance, and what everybody's gone through over the last 12 months, it's not just about getting the cheapest policy anymore. I don't think, obviously, you know, cost is something to think about, but it's about all the other support and advice that you get from somebody like Partners. And I think it's a case of not just it's thinking about the policy and the agreement that you're going for and discussing it with somebody like yourselves to start with.
Yeah, absolutely, Rob. I mean, there are many examples we can give you of that, where I guess the pitfalls of cheap insurance, if you like. You know, I'd love it if probably put me out of a job, but I would love it if insurance policies were written in a much more simple way that everyone could understand. You know, that advice around it, understanding your business, understanding what the risks are, and then arranging the insurance to fit around that is the key. And it won't be a one size fits all. So I think the importance for a gym operator to speak to someone that can advise them in a professional way and get that actually genuinely wants to understand their business, that's key. If they have that, that's a good starting point for getting the insurances on the right basis, really, Rob.
Yeah, definitely. I agree. And I think it's a bit like we had a chap last week talking about utilities and things and how you can reduce your energy expenditure. And there's things you can do with your insurance that it will help the moral obligations and all that that come with it, but helps you reduce your costs, I'm imagining.
Yeah, absolutely. Well, I think it's getting the risk management that we've spoken about today right. It's a long-term play, because you won't necessarily notice that immediately. It won't pay off straight away, but over a period of time it will definitely pay off, because you know, if you start to have claims and issues, the chance of being able to arrange insurances at a lower cost point diminish. And in the market that we're in, as at the moment, if you've got a really poor record, you know, you may get to a stage where no one wants to insure you. So you need to avoid that, and that's essential for being able to trade and operate a business. So
yeah, I agree. One sort of, I suppose, technical. There we go. Ben's asked a question. I'm just going to pop the chat open. If you rent the place for a studio gym, does it fall on you or your landlord to check for asbestos?
It would depend. I'm on unmute, Anna.
No, we can hear you.
You hear me? Yeah. It would depend on what it says in your lease. Basically, the control of asbestos regulations specifies a duty holder, and that could be the person in control of that premises. If you're in control of the maintenance of that premises, then you're in control as a duty holder of the asbestos as well. If it stipulates that the landlord is in control of the maintenance and upkeep of the premises, then the landlord could be the duty holder.
Perfect. So check your lease, Ben. I think effectively, if you've got to keep the upkeep of your building, you're going to have to look at that yourself. Another sort of very topical sort of observation is around digital solutions. And I'm imagining when COVID hit and everybody turned to Zoom and Instagram and so on, there must have been a pretty, not a panic, I'd say, but in terms of the policy changes or things that had to be implemented to allow people to be covered for remote and online training. Did you see how much work was involved around that at the beginning, Neil?
Yeah, well, it's something we recognise almost immediately because we're working with so many gyms. It's about 800 independent gyms and health clubs that we work with. So we had probably in March, we had the question 10 times about them looking to pivot towards digital and so on when it became clear how the situation was developing with COVID. So I guess we were able to react to that fairly quickly and spoke to, whilst we've got access to a whole range of insurers, there's 3 main insurer partners that we're predominantly working with that we're able to contact and get agreement with them across the board that they were going to cover online fitness. So that was fine. We've come across through other policies some strange and weird conditions around operating on digital fitness. So things like restrictions on numbers, which seem bizarre in an online environment where, obviously if the well-documented cases like Ben Wicks are training 1 million people at a time. So why would you have a restriction of 40 people in any online class? It doesn't make sense. So there are some challenges with insurers understanding that. But I guess again goes back to the point of I think anyone who's a specialist in this area will understand the sector and will know what's trying to be achieved there. So because I think the digital model is here to stay. Rob, is that your view? It's not going to go away just because gyms are able to reopen in bricks and mortar. So
yeah, I'd agree. I think the digital platforms will be here definitely for another 6 to 12 months. I think they're going to be a part of it. A lot of people are hesitant about returning to gyms. So I think there'll probably be maybe 20% of members that will still work out from home or still want to do 1 or 2 alongside the gym workout just because of working patterns changing. So it's definitely going to be around. I think my advice around that is just make sure you have checked with your insurance provider specifically that they're covering it. But as I say, it was kind of for us, that's an issue that was dealt with and addressed probably 14, 15 months ago. So I still see in other groups on Facebook, and a lot of people asking, am I insured to work out online? It's like, we're 12 months into this now. If you haven't checked that already, you're probably a bit late, but there we go. I think one thing I think to sort of drive home really is talk about the legalities around the health and safety requirements. And if you don't hold up the legal what you have to do, you could get prosecuted. Am I right in thinking it's the owner of the business themselves will get prosecuted, or is it the business that would pay for it?
Sorry, my dog's just barking. Somebody is dropping something off next door. It would depend. Employees can be prosecuted if they've breached the Health and Safety at Work Act or any health and safety law, but it's generally it falls to the person who's at the top of the organisation, so directors or owners, etc.
Yeah, I'll just add to that whilst Chris's dog is calming down. I think Chris mentioned about insuring or not being able to insure against those fines as well, which is a really important point. So you can insure against the costs of defending those prosecutions through a directors and officers policy or management liability policy, but you can't insure against the fines themselves, not in the UK anyway. That's really important. There is that quite strict onus or obligation on gym owners, on directors, and so on. But that policy, that directors and officers policy, is designed that it covers everyone that could be involved in there, the owners, the directors, the managers, so anyone that is in a position to make a decision where they could potentially be prosecuted. That policy is there to act, but it's not a get out of jail free card.
Yeah, I think that's the thing, is it sort of take this seriously, because it can directly financially sort of complicate, well, it can impact the individual. So just something that has to be taken seriously in the business. Yeah, right. That was the last of my questions. So unless anyone else has got any others, I don't know whether Ben's got any other questions. We'll sum it up there. I think that's really good presentations. There's loads of, it's a minefield of a subject area. So it's absolutely minefield, but there's some good tips to be aware of and things you can look at. You talked about the risk management guide. We put that into the newsletter a couple of months back, so I don't know whether that link is still live. We can put that link with the video as we post it into the Facebook group. But generally, guys, obviously, if you've got any questions around your the health and safety requirements or insurance, reach out to Partners, and they're a lead partner with us, so provide a huge amount of information and resources and support. And on that note, we'll wrap up there, and thank you all for joining. Cheers, guys.
Thank you very much.